Selection of patient position for manual traction is dependent on the patient's presentation. Please refer to the manual for guidance. The patient may be positioned in supine with their legs extended. Expose the patient's skin to maximize friction between them and the table. Wrap the belt in a figure 8 pattern around the patient's ankles and slip your hands between the belt and the patient for reinforcement. The belt should be low around the therapist's hips. After the belt is positioned, the clinician should stagger his feet and gently lean back. This will create traction on the lumbar spine. Alternatively, the patient can be placed supine in a hook-lying position with the belt wrapped around the back of the patient's knees. The clinician places his hands between the belt and the back of the knees to increase patient comfort. If the table is higher, the belt can be draped around the therapist's shoulders. Again, as the therapist leans back, it will create traction at the lumbar spine. The therapist also has the option to kneel or sit on the table with the patient in the previous position and lean back in a similar manner. The patient with an extension bias can be placed in prone as well. The belt is used in a figure 8 pattern around the ankles, similar to the supine position. Be careful to grade the amount of traction during extension to avoid pain. If the patient responds favorably to manual traction and would like to use traction at home, the patient has the following options depending on his status and tolerance for loading. The patient hangs a towel or sheet off the end of a sturdy door and grabs the towel with both hands. Then he progressively decreases the weight on his feet by bending his knees and allowing his outstretched arms to accept more of his body weight. The patient should stand as close to the door as possible to increase the traction force going through the lumbar spine. This technique may be contraindicated for patients with shoulder pain. The patient may also lie supine on a towel on the floor between a doorway. The patient takes a bar, places it over his head on the opposite side of the doorway, and pulls. The pull will create a traction force on a lumbar spine and may be tolerated better with patients who prefer extension movements. If the patient finds it easier, he may reposition himself hook lying, push down on the bar to increase lumbar traction. This may be better tolerated with patients who prefer flexion movements